Hello, my name is Priyanka Pratas from Let's Update Language Academy and I'm with.
My name is Akhila John Kurushingal. I am one of the trainers in Let's Update Language Academy.
So we are here after a long day of work and students have gone and we've used this classroom actually to present a role play card, right Akhila? Yes. So we'll be here with our role and we are actually here to present a role play card. That's our latest role play card which was asked in the February 5th examination. The setting is emergency department and it's about a 3-year-old child and the mother is here with a lot of questions and the nurse is here to give information about the aftercare. Actually, the child is about or due for the discharge. So she'll be playing the role of the mother and I'll be playing the role of the nurse. So can we move into the card?
Yes.
Okay, so usually we have 3 minutes as a preparation time, so we don't look right now, we are moving straight away into the card. So shall we start?
Yes.
Okay, so, alright, so good evening.
Good evening, ma'am.
My name is Priyanka, I am the nurse in charge of this emergency department.
Okay.
Can I confirm your name?
Yes, ma'am. My name is Meena.
Okay, Meena. So I think you're Rayan's mother, am I right?
Yes.
Okay, so from the case note, I understand that Rayan had a buccal fracture on the right wrist and he also have a removable splint and now he's ready for the discharge, right?
Yes.
Okay, so I'm here to explain you regarding the aftercare procedures and further management, okay? But before I move into that, tell me, how are you feeling right now?
Ma'am, actually I'm very glad and pleased to hear that my child is getting discharged.
Okay.
And he's so happy right now because he is feeling much better than what he have arrived here with. Yes.
Oh, I'm really feeling very glad indeed that you and your child is very happy about the discharge.
Yes.
But at the same time, I should mention that it is very important to continue the pain relief, okay?
Yes.
He has got, he can take paracetamol or acetaminophen as a regular dose for the next 24 hours because there is a chance of mild pain. So since he is a child, it is better that you can give this pain medication if it is not manageable, okay? And to give you more information, I really want to collect some more information. So can I ask you some questions?
Yes, ma'am, sure.
Okay. Is he attending any childcare center or he has got any siblings?
Yes, ma'am. Actually, he is attending a child care center about a couple of mornings in a week, and he has an elder son. Actually, I have 2 sons. The elder one, he has an elder son.
All right. So he must be very active.
Yes, very active at this age. You can imagine.
Yeah, that's true. And I'm very happy also to know that. But I'm sorry, for the next 3 weeks, it is very important to note that he should be away from the sports or rough games. Okay, so he can definitely play and enjoy, but after this 3 weeks. So this can actually prevent him from further injury or increased pain. So make sure that he is safe and he is resting. Okay?
Yes, ma'am.
And I hope you know about the removable splint in his hand. So do you have any idea about its management?
They have already mentioned that my child need to wear this for coming 3 weeks.
Okay.
But ma'am, I don't know much detail about the aftercare or the management. Nothing. I don't know in details.
Alright, don't worry. I can explain to you. Actually, this removable splint uses for 3 weeks. And it has to be 24/7 every day and night he need to use and he is not supposed to even remove even when he is bathing. So please take care of that, but don't worry, you can permanently remove this after 3 weeks, okay? But when you notice any soreness or stiffness or if it is painful, then please do contact the hospital because we will have to reapply it. Okay, is that clear?
Ma'am, like you have mentioned that I can remove it by myself. I would prefer to bring him to the hospital or any clinic for that.
Well, I totally understand. As a loving mother, it might be really, very worryful. I mean, you might be concerned about how you will remove this and all. But I can tell you that, I can assure you that it is manageable. It is manageable for you. You can remove it by yourself and there is no medical attention required at this point.
Okay.
But at the same time, I can note down certain things. After 3 weeks, if the wrist is painful, as I mentioned, if it is painful, or even after the removal, if you notice that the movement of the wrist is limited, the hand and fingers movement is limited, and if he is feeling numbness, you can touch and inquire him about that.
Okay.
And if he is feeling any numbness, it is better you can come to hospital. Otherwise, don't worry at all. It is manageable for you yourself. Okay?
Like, I'm happy to hear this all information. Yes, now I got a better picture regarding the management of this place.
Alright, even I'm happy. I hope you're comfortable with the information,
Yes,
right?
ma'am,
Okay, so is there any other question?
No, ma'am, I don't have any other question. So yes, I'll be waiting for 3 months until my child is getting well.
Okay.
And in case, as you have mentioned, I'm noticing anything, symptoms like that, I'll be here.
Alright, but I'm very glad to say that not 3 months, you only have to wait for 3 weeks.
Yes, 3
okay.
weeks, yes.
So thank you so much. If you have any doubts or queries, you can come at any time. Okay, thank you.
Thank you.
Okay, thank you. So that was the scenario. And when I was talking to Akhila, I think we both were feeling very natural that I could enroll into a role of nurse, and she was truly a mother of 2 child. Yes, so the scenario was pretty natural. So what I always request to my students is that assimilate or inhale the essence of the card. Yes, if you can take up the role, and it would be really easy. You do not have to think about all the reassurance part. It will come very natural. Understand that the mother is quite worried. This beautiful lady is quite worried. So understand that she has concerns about her child. In that way, when you connect, all the phrases that we have studied will come very naturally. It was quite a long card in the examination, and the students were a little panicked during the exam, according to the reviews which we have collected, right? So it is better if you can take the essence of it by understanding where all we need to give advice, where all we need to ask questions, and what all are the recommendations that we need to do. In that way, if you can analyze, it would be really easy to handle. So practice this card twice or thrice and understand how we can manage the time, and also a big card. So this will be really helpful for the coming examination.
Yes.
So all the very best. Akhila ma'am, do you have anything to say?
Yes, she have mentioned everything. Just keep working on that. Nothing to be like overly concerned about the card. Just do it, as we already know it's a role play.
Yes.
So we have to act.
Yes. So thank you so much. So this is Priyanka Pratas
And this is me, Akhila John.
signing out. Bye.